It's fall sports season, and across the country, athletes are training hard for marathons and other activities. But for 1 in every 500 people, an often silent heart condition may put them at risk for sudden cardiac death.
By far, the most common cause of sudden cardiac death in older athletes, particularly marathon runners, is coronary artery disease. But in younger athletes, particularly those involved in high school and college sports, the primary cause of sudden cardiac death can be an inherited heart condition, such as hypertrophic cardiomyopathy. Hypertrophic cardiomyopathy is a genetic heart condition that causes abnormal thickening of the heart muscle, and it can lead to abnormal electrical heart rhythms and can cause symptoms such as shortness of breath, chest pain, dizziness, or in rare cases and very tragic cases, a sudden cardiac death caused by a cardiac arrest.
55-year-old Tim Wilkes was diagnosed with hypertrophic cardiomyopathy, or HCM, when he was much younger. Although he's had the condition since birth, he didn't experience any symptoms until a few years ago, a common scenario for those with HCM.
I've been fairly active, and I'd played softball and basketball, and I could tell that when I'd stopped doing those things that it was related to the HCM condition. For a while there, I wasn't sure if it was just getting old or if it was part of the HCM, and it turned out that it was mostly the HCM.
Tim came to the Hypertrophic Cardiomyopathy Clinic at the University of Michigan Cardiovascular Center. There, a multidisciplinary team evaluated his condition and suggested a surgical option to normalize blood flow within his thickened heart.
It's been 16 months since my surgery, and I have no complaints at all. I'm off of just about all the medications except for some aspirin, and I can do as much activity as I want to do.
Tim hopes that genetic testing and HCM screening will help his children assess and manage this genetic condition. But what about the general population? Should all young athletes be screened?
I think the most important piece of advice that I can give athletes is that they get a good physical examination in history by their primary care physician. For younger athletes, that should involve a comprehensive pre-participation screening physical examination in history. If anything is concerning on either of those, they should have further testing with an electrocardiogram and maybe even an echocardiogram as well, or an ultrasound of the heart.